Our next talk is going to be social workers' role in transplant. Tracey.
Good morning, everyone. My name is Tracey Braithwaite, and I'm one of the social workers on the transplant team. Today, I have two of my colleagues, Elsie Cherry and Miss Fleur Joseph. Would you mind standing? Wonderful. And I want to also recognize Susan, who is not here. She's our social worker on the post-transplant side. Today, I'm going to talk about the social worker's role in transplant. And you will learn why social workers are essential to the transplant journey and the important elements of consideration for the transplant biopsychosocial and what approaches we use in terms of practice in our transplant team in terms of the decisional making. So why are social workers essential to the transplant journey? First of all, the law mandates it. CMS, which is the Centers for Medicare and Medicare, dictates or mandates that social workers be a part of this dynamic team. And we do have a dynamic team here at Downstate. We complete what is called a biopsychosocial as part of the evaluation process. And this is on a continuous basis. So we meet patients who are there, who comes in first to be evaluated at the pre-transplant phase. And we also evaluate them at the wait list because every year it has to be done annually. And we also evaluate them at the post-transplant phase. So every potential candidate is evaluated from a holistic point of view. We don't look at the patient just on the medical aspect of their lives. We look at the sum of the parts. What makes up this patient? What's going on besides the medical piece of information that might be affecting them? So we evaluate the overall functioning and how are these patients adjusting in the community? What's their quality of life at this point? And this gives us an opportunity to educate, empower, and counsel our potential candidates, as well as their families on the transplant process. The biopsychosocial evaluation also helps us identify barriers. As Dr. Markel just indicated, social determinants are a big factor. And we know that it impacts our patients. We know that it impacts our community. And so social workers play a dynamic role in identifying these barriers so that we can help each and every one of our transplant patients. Our goal is that everybody should get a kidney, but we know that's not realistic. And if we could remove some of those barriers, I think we would have more patients to transplant. And so that's our goal as social workers. We help to develop a mutual agreement with our patients and try to link them once we identify these barriers and link them to resources in the community. We also provide ongoing support and advocate for the recipient's needs. We provide brief counseling as needed. We determine whether these patients or the recipients, potential patients or recipients, will be able to partner with the team. It's essential that patients partner with us. The reason for that is that we want these patients to have this kidney for as long as they can and life permits. Based on the information that we are able to gather from the biopsychosocial, we're able to speak on this at the selection committee meeting. And we provide the team with accurate information to ensure candidacy selection is appropriate. So as you can see, that was the major parts that are essential for us social workers. So these are some approach that social workers actually use to determine, to help with our decisional making. We recognize that the patient is the central part of the transplant. And so we focus on a central patient-centered approach. We also realize that there is need to collaborate not only with our team, but also the patient. It's essential that we do this. And we also look at the systems theory, which look at the patient that's connected to all the different systems out there. We have a team approach, which means that we do not also make decisions by ourselves. We work along with our team. We work along with our leaders so that we can come up with the best approach for our patients. We're very good at problem solving. So this is also part of our role. When we have patients who we identify that have a barrier, we're able to use our problem solving techniques to really make those necessary connections for our patients. And because we move into a high reliability organization, we know these principles are embedded in the We Care message. And so we're looking to make sure that every patient that comes in here feels warm and welcome, and they feel that they're getting the best care equally. We're collaborating well, right? We are holding everything that we do. We're looking at it from an accountability standpoint. We respect them, and we want to provide excellent care. So these are the approaches that we are using at this present moment. And so you learn that the important elements of consideration for transplant, the biopsychosocial, the medical history. As I said, we don't look at just one aspect of a patient. We look at everything that is a part of this patient. So we look at the sum of the parts, the medical history, the mental history, substance abuse history, the available supports. We have up here minimum of 2 persons, yes, because we use a tool called CIPAT, and that is one of the requirements. It's minimum. And we know that supports are very, very essential. That's something we look to. We know that within our community that many people may have struggles with this, but we try to work with you as well by also putting in supportive services, home care services, whatever services we could help to minimize or have, and that may have an effect, we try to decrease that for you. So we also try to look at whether the recipients and their supports are ready for transplant. We know that, many people want to have a transplant, and we're for everyone getting a transplant, but we want to make sure that they are ready. They have the necessary tools that will propel them for a good time. We also try to look at we try to identify the stressors. What are some of the things that might be affecting this recipient? We look at, do they have adequate housing? Are they food deprived? Do they have adequate financial resources? Are there any current legal issues? As the attorney, Ms. Adler had mentioned that some patients who are undocumented, in this community, there's a vast amount of people who are undocumented and may feel that they are not going to be transplanted. So we make that connection with the attorney to really evaluate whether this person can be a candidate, from a legal standpoint to get the necessary medical insurance to cover the cost of their kidney transplant. Also, family relations conflict. Sometimes, patients don't want to talk about this, but it's actually happening, and it is a stressor for them once they are transplanted. That's when you realize that they're having so much conflict, and we're able to try to find out that before they are they're transplanted. Sorry. We also look at whether they're able to cope with stress in difficult times. And again, we look at the ability to partner with the team. Okay, so this is the case study that I've selected. Mary Berenium is a 74-year-old Hispanic female who presents for an evaluation along with her 85-year-old husband, Frederick Berenium. She has a medical history of end-stage renal disease since 2018 and attends USA Dialysis Center regularly. Together, they have 4 children, ages 24, 27, 35, 34, and 35, who are very involved in their daily life, but does not live in the same household. But Mary and Frederick do not appear to be their stated age and do not use any supportive devices. So what else is essential to know about Mary? To the audience, what do you think? I've listed some key important things that I think is very, very important and helps us to make a good decision and wise decision. What do you think in this scenario might be needed? Okay. Yes. Absolutely. Those are essential things. And, one of the things is that the kids, they live outside of the home, which is something that we tend to look at because both of them are elderly people in the home. And of course, young people have their own lives to live. And so what else do you think that we could do to help this family? Yes. And what I would recommend too is home care services, because they have 2 elderly people in the home. So it's key for us to provide them with the necessary home care services to, minimize that stressor for not only the patient, but also the family. The family not, they're at work and they're wondering, why is this patient, how is the patient adjusting to life without them? So we want to make sure home care is a key piece in this, right? Should this patient be given an opportunity? Now that we've listed the age here, like Dr. Rashawn mentioned earlier, age is not a factor, but should we list somebody like this? Should we give her an opportunity to be transplanted? Yes. Well, ladies and gentlemen, thank you for your time and all the best.